Well, thank you all, and thanks to the organizers for inviting us here today. So today I'll be talking about the impact of Urolithin A. You've already heard from Dominique a little bit on the details on the impact on immune, and I'll be expanding and telling you a little bit more about what we're doing at Timeline and how Urolithin A is having a broader impact on the body, not only on oral nutrition, but also topically. So our company Timeline is based in Switzerland. We're based on the campus of the EPFL, which is a big technology university there, where we work with a number of scientists there, as well as around the world, including Dominique and others. And I think one of the things that distinguishes us about as a company that focuses on nutrition is the fact that we're really taking this biotech approach, and we're raising the bar in terms of the types of studies that we run, and actually where we publish those studies in top journals. And so we're really all about trying to tackle health span and longevity with the health span aspect in mind. And as part of that, what we wanted to do is to really leverage the science that we have, is team up with really dominant global market leaders, both in nutrition and in skincare. And we've been working with both Nestle Health Science as well as recently with L'Oreal. So there's no surprise here from Dominique's talk that I'll be speaking about mitochondria and the importance of mitochondria and aging. And so I think all of us are familiar with the importance of mitochondria inside of our cells and bringing the energy and to power all of our cells, impacting not only our muscle, also our brain, immune, joint, skin. It really impacts our entire body and how we live, and it's a very interesting way to approach aging, because you can target it so well, and there's a number of interventions and nutritional interventions that you can use. And when you think about cellular aging, it really starts with a decline in mitochondrial function, and then you see a decline in the cellular function. This leads to a decline in basically organ function, and then you start to feel it. And if you think of muscle decline, as you get older, your muscle health starts to decline in your 30s, and then it's really heterogeneous. And what we want to all avoid is following this track here, where everyone ends up, on that track unhealthy, and we want to keep people aging optimally throughout their lives, and that's what it's all about, and that's what our goal is at the company. And so there's a number of ways to promote mitochondrial health that can help us while we age and help promote our health span. And one, of course, is dietary interventions. We've all heard about intermittent fasting and how this can have an important effect, but this is perhaps not always appropriate. Also eating various polyphenol and antioxidant-rich diets. There can be aspects of the bioavailability of some of these antioxidants. And then exercise. Exercise is a great way to sort of stimulate mitochondrial biogenesis. And then, of course, in addition to these lifestyle changes, we can also try and take some supplements that are interacting at the cellular level on your mitochondria. And today we'll be talking about Urolithin A. And so Dominique gave a little bit of an overview on the origins of Urolithin A, but I'll dive a little bit deeper into that. So if you're thinking about the pomegranate, which is one of the products, natural products that is really delivering the most Urolithin A, it contains compounds called elagitannins, which are very complex compounds, and when you consume them, what happens is the gut microflora transforms them into a postbiotic that's called Urolithin A. And unfortunately, we don't all have the right gut microflora, so it's only about 30 to 40% of the population that can actually convert these elagitannins into Urolithin A. And what we've seen, and one of the discoveries that we made early on was that urolithin A is actually stimulating and improved mitochondria health in cells. And we did a deep dive to understand how that really worked. And what we saw was that it was stimulating this process called mitophagy. And so how does mitophagy improve mitochondrial function? So this is a nice cartoon that really oversimplifies the process. But essentially, as you're getting older, the cell's natural process for maintaining mitochondrial function is decreasing, and this process is called mitophagy. And so what mitophagy does is take a damaged mitochondria, and then it takes it into a recycling stage where the damaged one is engulfed in, and then it is recycled, and then the components are then used to sort of rebuild healthy mitochondria inside the cells. And as we get older, mitophagy levels decrease in our cells, and as we're more sedentary as well. And so what you really need to do is to boost that level of mitophagy to sort of kickstart the cells so that they can continue to maintain healthy mitochondrial populations. So we've done a number of studies, and this is work that was published together with Professor Johan Owerks back a number of years ago in 2016 in Nature Medicine. And this is where we really took a deep dive on urolithin A and tried to understand how it was impacting mitophagy, also what the benefits were in various animal models. And we started looking at worms, and then we moved onto rodents. And what we saw was that when we gave one of the precursors to urolithin A, ellagic acid, we saw there was no impact on the lifespan of worms, C. elegans. And then when we administered urolithin A, we see an impact of about 45%. And there was also a whole series of studies looking at all the pathways involved with mitophagy and knocking them down to prove that, in fact, this life extension was due to mitophagy. And, it's interesting just to take a look at, the impact of Mitopure versus other sort of lifespan interventions that have been explored out there. And, of course, caloric restriction remains the gold standard. But right after caloric restriction, we see urolithin A, and then we see metformin, which is a drug, and a lot of others, including rapamycin, spermidine, and resveratrol fall significantly lower in that. And so we went from worms obviously into rodents and into mice, and we showed some benefits on mice. In fact, I'm going to show it's actually some unpublished data that was recently performed by one of the scientists at Timeline, Julie Phage, and so looking at older mice, 21 months old, and giving urolithin A for a period of 8 weeks. And we always talk about improving of mitochondrial function, but what does that look like? Well, she took a deep dive and looked at that using EM, and what you can see here is that the mitochondria volume in old animals and the muscles of old animals decrease significantly, but when you treat those animals with urolithin A, you get a restoration there. And then also in terms of the mitochondrial complexity, in terms of how the mitochondria connect and interact with one another. So that was pretty exciting, and she came up with a very cool little cartoon here. This is from a sample from one of the soleus muscles, and so you can see sort of the difference in complexity here. So here on the right, you see old plus urolithin A and a highly complex structure, and on the left, you see the old plus vehicle, where the mitochondria are more sort of spread out. We also looked at other muscle types, including the gastrocnemius muscle, and so this is it's really exciting data, and we'll be publishing. So this is not yet out there. Yes, it impacts mitochondrial function. It also impacts muscles function. We saw in a number of rodent models how it improved running, increased running by over 50%, increased running endurance. And this also translates into humans, and so it's really nice that it's translating across species. When we've run a number of clinical studies now in humans. Our first clinical study, we looked at the impact on mitochondrial function by taking biopsies before and after the study and looking at gene expression analysis. And if you look on the left side panel in trial 1, you can see the placebo 500 milligrams and 1 gram of urolithin A, and what you can see is a dose-dependent increase in the expression of mitochondrial genes. And so that, that really encouraged us to go forward and run a number of other studies. And so we ran a second study in middle-aged adults who were sedentary and overweight, and we showed that administering both either 500 milligrams or 1 gram was increasing the muscle strength of the leg after a period of 4 months. And then in a third trial, looking at adults, older adults, 65 and older, we looked at a dose of 1 gram, and we see an improvement after 2 months in the muscle endurance in the hand, the first interosseous muscle, and also in the leg muscle. So we see a very consistent impact on mitochondria and actual functional outcomes on muscle. We've also recently conducted a study looking at muscle recovery, where we see a nice effect there, and that hasn't been published yet. And so you've already heard from Dominique of all the efforts we've made on the immune system, and we've also moved into topical applications because, of course, our skin, as Luke was saying yesterday, is our largest organ of our body, and our skin cells also contain mitochondria, and we're exposed to the sun. And so if you look at the left panel, you can see basically this is coming from a publication, Aging Cell. It's not ours, but what you see is a decline in mitochondrial gene expression as people get older in the skin, which isn't a surprise because we see the same thing across all the other muscle tissues. And what we see ex vivo as we give urolithin A at increasing doses, we see a boost of various gene sets that are linked to autophagy, mitophagy, also to mitochondrial function. And we've done now several randomized clinical studies in humans. And on the right panel, what you can see is the fact that people taking urolithin A for 8 weeks, we improve actually the wrinkles, the structure on the face. And that's it's really part of the fact that you're improving the biological function of the cells, and also that's the collagen production as well, and that helps maintain the whole matrix. And on the second panel on the right, we ran a study looking at UV exposure of tissue, and we see that we're able to dampen inflammation following that. And so we also have there's a number of applications, as I mentioned before, would impact joint health, and this is preclinical work that's been either published or in the process of publication on joint health. We did some work together with Scripps a few years ago, and we showed a key impact there in joint cells, as well as heart health, and that's a study that Davide D'Amico has been overseeing and will be published soon, and showing improved heart function during aging. And so just wanted to kind of come close to the end here. We're collaborating with a lot of world-class scientific and clinical advisors, many of them who are either here in the room or you may have heard of. But I think one of the important things is actually taking this active urolithin A, which we call as Mitopure, and turning it into products that people can actually take on a daily basis to improve their lives. And so there's a lot that goes into that. It's more than just the science and the clinical studies, but it's actually going through the whole regulatory process with the FDA to get what they call GRAS approved, generally regarded as safe, having the right quality levels of the product, having high purity, running these clinical studies, and then developing products that people want to take, and having the best food safety that you can have. So it's really an ensemble of activities that allows us to take this into the market and to consumers' benefits. And so just as I finish up here, so we're selling two types of products today. Some nutrition products, they come in the form of soft gels and vegan soft gels, and as well as in powders that you can put into basically smoothies or yogurts. And then we also have, in the last 18 months, introduced topical products into the market. And so this is sort of facial products, day cream, a night cream, and serums, and we'll be expanding the range of products. And with that, thank you very much for your attention.
Time for one question. Who raised their hand first? You.
Thanks, Chris. I'm a big fan of your products and using them whenever I can. The question is regarding the grip strength. I saw that there was less increase when it was higher dosage. Is there a low diminishing returns? Did you check dose dependency? Is it the only case, or it's happening more often?
We've in our first clinical study, we ran 500 milligrams and 1 gram, and we saw a comparable effect on actual leg strength, but in other parameters, we did see some improvement for other benefits. And so, not getting into the details, I think what will be interesting is to continue to study Urolithin A at various doses for various time durations in larger groups and larger populations, to really try and understand the whole diversity of benefits that you can have at different doses. Thanks for the question.
Thank you, Chris.